Aruna Pawar.
Aruna.
Hi, welcome to this hair care initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have a thinning of hair or bald patchy hair. But now, even younger age people are complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Aruna Pawar is a well-known dermatologist and has been practicing medicine for over many years now. She is MBBS DDV, specializes in dermatology, cosmetology and trichology. Currently she is practicing as consultant dermatology at Skin Logic and Medical at Port Road, Pune. Dr. Aruna Pawar has dedicated her career to diagnosing and treating a wide range of skin and hair problems and provided a personalized healthcare services to her patient. She take time to listen to her patient concern and work closely with them to develop a treatment plan that meets their requirement. Dr. Aruna Parwar is also aware of the need for the patient education and awareness about hair care and skin care and spend a lot of time in giving talks at various platforms across the country. Thank you, Doctor, for spending your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Yeah, thank you so much.
Dr. Hamai sir, uniquely बहुत बहुत शुक्रिया. So today we are going to talk about hair care in current scenario. So whenever we talk about hair care in current scenario, the very common problem which is faced by all of us, irrespective of gender and age, is hair loss. So can you please enlighten us today, like what's hair loss and like what's normal and when to be concerned for?
Yeah, actually, there is huge difference between the hair fall and hair loss. The hair fall is actually hair you are seeing on your bed, on your towel, in the bathroom. These are the actual hair fall. Hair loss means the thinning or recession of your hairline. That is the which is the normal for the females and what is normal the M typical in pattern in case of males. So the difference between hair fall and hair loss is this, but according to your age, according to your gender, and according to your you are in a which state, like pregnancy, then hormonal status, and then in menopause, the hairline, the hair recession, and the pattern of your hair loss can vary according to that. So normally 30 to 40 strands per day is considered as normal. More than 50 to 60 strands is considered that should we have to look for the proper management, and more than 100 is a significant hair fall.
Okay, so like when you are like you're having more than 100 and people are just saying that अरे तुम्हारे बाल हर जगह गिर रहे हैं, so that means कि अभी हमें डॉक्टर के पास चले जाना चाहिए instead of waiting more to fall off. Okay, so very interesting, doctor. So, doctor, like now that you mentioned certain terms which are like maybe the causes of hair loss, so people जिनको होता hair loss, they keep asking कि मेरे को ही क्यों हो रहा है? So they are quite not sure the causes of hair loss. So can you please enlighten like what are the general causes of hair loss?
Yeah, so there are multiple causes for hair loss. The first and foremost is a familial history or genetic pattern. हर किसी का genetic pattern and the pattern of your hairline is different. Okay, then there can be a nutritional type of hair loss. मतलब कुछ nutritional deficiency है, जैसे iron deficiency anemia हो गया, B12 हो गया. Then there are the multiple calcium, vitamin D3. These are also associated with the hair loss. Then again, the hormonal causes will be there, like thyroid disorders, adrenal hyperplasia. Then many times the PCOS, polycystic ovarian syndrome, is also considered in case of females, and there they can have the multiple hair loss patterns or hair fall patterns. Then can be a drug induced. Then anti-chemotherapy or chemotherapy, anti-cancer drugs, they are involved in that. Metabolites, and there are the multiple medicines. If you are taking for any systemic illness, they can cause the hair loss or hair fall to occur.
Okay, so there are like a lot of many causes which can lead to hair loss and uh, doctor that like nowadays like we are living such a busy life and we don't have time to eat on time also and we also depend ourselves on ready to eat meals where we don't cook, and the lifestyle is like very busy. So can a person lifestyle play a very important role in hair loss?
Yeah, yeah. The stress is most and most important nowadays for causing only a hair loss. We enlisted the multiple causes, but that is not true. Every time, each and every cause is regarding to that patient. Many a times, only a stress can cause a more hair fall or hair loss. So we usually advise patient like 3 to 4 liters water per day or 6 to 8 hours sleep is necessary. Screen time should be minimized. But now the IT professional or like they are working like continuous 8 to 9 hours in front of the screen, and they can cause a more hair loss and different hair loss patterns.
Okay, so even the lifestyle is a very important, and हम लोग को lifestyle पे थोड़ा focus करना चाहिए, थोड़ा ठीक करना चाहिए, so that all these lifestyle disorder doesn't appear. So डॉक्टर, अब जैसे अब हमें पता है कि hair loss क्या है, causes क्या है, तो एक जो this era of information where the information is flowing in internet and everywhere, people are quite confused what is the right medical treatment for them. So can you please, like, through this platform, aware people about what are the medical treatment options available for hair loss, like surgical, non-surgical, topical, or any other oral management which we can do for hair loss?
Yeah, the first and most important, very nice question basically, because many a times people self medicate themselves. They are using different kinds of oils and lotions and over the counter shampoos and some oral tablets. They are watching through the social media, and under influence of that they are using the multiple things. But actually the most important thing is hair analysis. Hair analysis should be done properly with the help of your dermatologist, and according to a pattern of your hair loss or hair fall, they'll guide you the multiple treatments. Some are oral, some are topical, some are procedural, some are surgical treatments. So in oral, most of the time we do a blood test or blood investigations for multiple reasons like iron, calcium, then your sugar level, then thyroids, and then many more like TIBC and ferritin. After that, vitamin D, T3, and B12 analysis is also important. With the help of that lab test, we usually add the oral tablets in the form of tablets or capsules in the form of injections or in the form of sachets like vitamin D3 we are going to add. Then there are some topical medications जैसे minoxidil हो गया या minoxidil finasteride combination हो गया. These are the different lotions, then shampoos, then there are multiple hair growth serums are also available. Then along with that, we can advise patients some procedural treatment like mesotherapy, platelet-rich plasma therapy, and if it is required, then we can advise them surgical treatment like a hair transplant or scalp micropigmentation and many more.
Okay, so there are like many different options, and it is always advisable कि हम डॉक्टर के जाएं and root cause पता करें और फिर treatment लें, instead of like blindly कुछ भी लगा लो and then waiting कि और बाल गिरें. Interesting. So, doctor, like, very informative. So, doctor, like, there is one, जब हम बात कर ही रहे हैं कि से आजकल self medicate करते हैं लोग. So, एक word है जो आजकल बहुत focus में हो रहा है, like, which is called nutraceutical. So, can you please enlighten, like, what is this word called nutraceutical, and what is this role of nutraceutical in hair care?
Actually, hair care, जैसे मैंने पहले ही बोला कि after the blood investigations, we have to look for the what are the actual deficiencies, what are the daily dosage of these micronutrients, and according to that, we can plan a therapy for the patients. There can be a daily dosage of therapy. Sometimes there is a 2-to-2 formula. Then sometimes there are some मेरी in case of different kit हो गया या females के लिए different kit हो गया, and
Hmm.
according to that the topical medications we are going to the patients. Yeah.
Okay, interesting. So, doctor, like, there are so many, like, on Instagram, on other platforms, there are so many products like herbal products, phytoconstituent, and omega-3 fatty acid, grapeseed. Are they really like useful in managing alopecia or hair loss? Like क्या
Yeah, actually, each and every content you yeah, so we can use them as antioxidant. We can use them as an adjuvant therapy also. So many a times these oral tablets are there. They are having many herbal contents in that, or there are multiple grape seed, yeah, plant extracts are there, and they are added as a therapy for the hair loss and hair fall. But we can use them with the proper dose, and if someone is allergic to that, we have to look also for that. But we can use them as a adjunct therapy, not a primary therapy कि अभी चलो ग्रेप सीड्स खा गए तो मेरे बाल आने लगे, ऐसा नहीं होता है. So we have to look for the deficiencies also, and we have to add the tablets regarding the deficiencies also, and we can take a help of this plant extracts and multiple herbal products also. Yeah.
Okay, very interesting. So, doctor, like now that we know that these nutrients have a bit of help, but people what they do is they just buy and they like there are so many different kind of gummies. They just eat it and keep eating it, and then they don't see results. So, is it required to take these nutrients as per gender RDA requirement or under the supervision of doctor?
Yeah, supervision of doctor is most important point, because after the proper analysis with the help of your dermatologist, they will guide you which deficiencies are there and which supplements you have to take according to your
Mhm.
gender, according to your age, according to your daily dosage. They will guide you, and
Mhm.
we have follow with the proper of patients also. Many of the most of the times पेशेंट एक ही महीने के लिए लेंगे, उसके बाद वो दे एक्सपेक्ट कि मैम अभी तो हेयर ग्रोथ आया ही नहीं है, या मुझे आई एम नॉट नोटिसिंग एनी डिफरेंस और दैट. But for 3 months we have to take a proper treatment along with your deficiencies कैसे क्या है, and a
Mhm.
combination treatment will help for that, like the procedural treatment, and if required, what are the different multiple options are there, the lotions and the serums at home, the derma roller. These are the multiple treatments available. So you have to treat with the combination type of therapy, and for the given duration of the time, not so less and not like for the long term, and then we can look for the proper management. Yeah.
ओके वेरी इंटरेस्टिंग सो डॉक्टर लाइक नाउ इट्स लाइक जब हमने हेयर लॉस पे बात कर ली है तो एक और कॉमन प्रॉब्लम है विच इज फेस्ड बाय ऑल ऑफ अस इज लाइक डैंड्रफ सो डज डैंड्रफ कॉज हेयर फॉल
Actually, dandruff will hamper your scalp. Basically, dandruff is nothing but a fungal infection, and it causes shedding of your scalp skin, and then it can watching on your shoulder, on your shirts, and then there is a sticky and greasiness of your scalp is also there. And etiology behind that is fungal infection. So fungal infection we have to treat properly with the antifungal medications and antifungal shampoos, lotions, and the oral tablets. But yeah, because of the dandruff, there can be a sharp damage can be there. मतलब रूट से नहीं, एक तो हम इजी स्काल्प होने के कारण रूट से भी गिरते बाल, एंड शाफ्ट से भी गिरते, मतलब टूट के गिरना, या ड्राइनेस या फ्रीजीनेस कैन बी देयर with the dandruff. So yeah, the dandruff can add more to aggravation of the hair loss.
ओके सो इवन डैंड्रफ लाइक डैंड्रफ का भी ध्यान रखना चाहिए क्योंकि इससे भी और डिफरेंट प्रॉब्लम्स हो सकती हैं एग्रावेट ओके इंटरेस्टिंग सो डॉक्टर हमने ना ये स्ट्रेस के बारे में बात किया कि स्ट्रेस से भी हेयर लॉस होता है एंड देन जब हमें स्ट्रेस होता है तो एक वेरी घरेलू नुस्खा जो हर ग्रैंड मदर बोलती है बच्चों को करने के लिए इज लाइक ऑयल का मसाज कर लो भर भर के लगा लो एंड देन दे से कि अगर लगा के सो जाओगे तो your hair will be stronger and thicker and it will grow more. So, what is the fact behind this? Oiling hair is boon or a ban?
Actually, oiling of hair, increasing hair growth or hair restoration is the most common myth actually. We follow the Indian tradition, उसमें बहुत सारा oil लगाने के लिए बोलते हैं, but which oil is you are using it is not important. बहुत बार herbal remedies कुछ try करके उसमें कुछ onion का juice डाल के या कुछ flowers के पत्ते डाल के they are making some kind of oil, and they advise you to apply. Basically, oil will increase the greasiness of your scalp, and then that can increase the further. infections. Like one is fungal, another is bacterial. Bacterial is nothing but your acne, so people can face the scalp acne issue. And the fungal is nothing but your dandruff. So again हमने अभी देखा कि डैंड्रफ से तो हमारे बाल टूट रहे, गिर रहे, फ्रीजीनेस, ड्राइनेस बढ़ रहा है, and we are not maintaining a proper scalp care. So it is again a myth. Basically behind the tradition or behind that myth, it is considered as कि जो ऑयल मसाज हम करते हैं during that time we are going to increase the microcirculation there, so that can be we can consider as a help for your hair growth or hair restoration. But oil too much of oiling and too much of massaging is not the solution for your hair loss. Usually for the dry scalp we can advise the patient ki oil laga lo, but only for 10 to 15 minutes and then wash it off properly. Don't keep it like overnight oiling, or that practice is completely a wrong thing. Yeah.
Okay, very interesting. So, Doctor, now my favorite part. Can you give us some important tips for healthy hair?
Healthy hair. Actually, hair care routine is most important thing. So for that matter, you have to wash your hair daily. In case of males, the length is very short, so we can shampoo it with medicated shampoo and the gentle shampoo, non-fragrant shampoo you have to use. Daily shampooing is very very necessary to maintain a hygiene and cleanliness of your scalp. So that can avoid dandruff problems, and that can avoid many scalp issues. Then, if you notice any redness, itching, irritation, inflammation, please go to a dermatologist and properly analyze your hair. And according to that, we can advise the further management. Stress is most important thing. For that, you have to exercise daily. Drink 3 to 4 liter waters per day, and 6 to 8 hours sleep is necessary. That should be a regular sleep. You can take a help of yoga meditation practices also to modify your lifestyle. And diet is most important thing, that should be rich with omega 3 fatty acids, iron, zinc, and the calcium, vitamin D3, B12, so should be there. And so diet, your multiple things like micronutrients are most important thing. And with the guidance of your dermatologist, we can have a combination treatments also, like oral tablets and the topical medications and the procedural treatments. We can take a help of that. So hair hygiene is most important thing. So in case of people also, thrice a week shampooing is advisable, and don't put like overnight oiling, and that should be not done. And you can instead use a different types of solutions and serums for your hair growth restoration.
Okay. Thank you so much, Doctor. This discussion was very informative. I'm sure our viewers have found the session very helpful. So, can we take some live audience questions?
Yeah.
Okay, so the first question is, हाय डॉक्टर, मुझे एंड्रोजेनिक एलोपेशिया और ये मेरी फैमिली में रन होता है। मैं डॉक्टर के पास गया था, डॉक्टर ने पहले मुझे कुछ मेडिकेशंस दी एंड देन उसके बाद डर्मारोला किया, बट उसके बाद भी कोई फ़ायदा नहीं हुआ। अब डॉक्टर कह रहा है पीआरपी करवाओ। क्या मेरे बाल पूरे ही चले जाएँगे या आई शुड गो फॉर पीआरपी एंड व्हाट डज़ इट डू?
Actually, with the proper analysis of your hair, the grade of your baldness should be looked for.
हुँ,
According to that, oral medications, topical medications, lifestyle changes, procedural treatment are important. जैसे मैंने पहले ही बोला कि combination treatment will work for you. In that matter, the PRP is platelet rich plasma.
हुँ,
Basically, हमने डेंगू या कोविड के इरा में भी सुना होगा कि प्लाज्मा ट्रांसफ्यूजन बहुत चल रहा है. Basically, plasma contains vascular growth factor, endothelial growth factors, various type of growth factors. They are very much needed for your hair growth restoration. So yes, you can take the help of your platelet rich plasma, and that is your own plasma. So don't have any kind of fear about that कि भाई ये किसका plasma use हो रहा है या मुझे उसका reaction तो नहीं होगा. Basically, we are using your own plasma, and that is very enriched with your hair growth factors. So yes, you can take help of that also. And before that, get your proper analysis and what are the causes and what are the treatments. Do have your proper discussion with your doctor, so that these kinds of maybe queries you can't have further.
ओके। बट डॉक्टर क्या जिनको एंड्रोजेनिक एलोपेशिया होता है, इट इज़ लाइक सर्टेन कि एक पीरियड के बाद उनके बाल जाएँगे ही जाएँगे और therapies can help them to retain their hairs for a longer time?
Uh, Yeah, so androgenetic alopecia, any family pattern of your alopecia, if it is there, so you can follow the same pattern also. But what we can do with this treatment now, अभी जो बाल है उनको बचाना is important. You have to improve the volume and density and the thickness of your hair. So for that matter, you can take the help of platelet-rich plasma and mesotherapy. अगर आपका hair loss का grade उससे भी ज़्यादा है and if hair transplant is needed, then doctor will guide you according to that कि भाई आप पहले आप platelet rich plasma करते, you have to improve the donor, and then we can do a hair transplant on the certain areas of your scalp. So for that matter you have to properly discuss with your dermatologist.
Okay, so basically, it is always with the help of the doctor instead of thinking and
Yeah,
suffering कि यार ये तो चले ही जाएंगे तो अब मैं क्या ही करूँ डॉक्टर के पास जाके.
yeah.
हाँ, Okay, another question from our viewer is, हाय डॉक्टर, मुझे डायबिटीज है. जब से मैंने इंसुलिन लेना चालू किया है मेरे हेयर लॉस ज्यादा हो गया. क्या हाई शुगर या इंसुलिन से हेयर लॉस होता है?
Actually directly say इंसुलिन से ही होता है, but yeah, so if you are having any systemic illness, so there is a physical exertion, there can be a micronutrients loss, there can be associated with genetic pattern of your hair loss, and if again stress induced factor is also there. So for that matter you have to maintain a proper sugar with anti-diabetic medications or with the help of your guidance of your medical practitioner. So for that matter, your sugar should be controlled. Matter. So diabetes can be associated with hair loss, but we can't say कि directly it is a cause for your hair loss.
ओके. ओके, सो डॉक्टर लाइक क्या मेडिकेशन से एग्रावेट हो सकता है हेयर लॉस, लाइक एनी काइंड ऑफ
Yeah, there are
मेडिकेशन?
certain medications are there, जैसे मैंने बोला कि एंटी कैंसर ड्रग्स हो गए, एंटी मलेरियल ड्रग्स हो गए या एंटी मेटाबोलाइट्स हो गए. तो इसमें ऐसे मेडिकेशंस यूज या रिमेटॉइड अर्थराइटिस के लिए मेडिकेशंस फॉर द लॉन्ग टाइम पेशेंट इज टेकिंग, तो ऑब्वियसली दैट कैन अफेक्ट योर फिजिकल हेल्थ also, and that can cause a further loss of your micronutrients and can cause a hair loss.
ओके. अनदर क्वेश्चन फ्रॉम व्यूअर इज, हाय डॉक्टर, आपने कहा पीसीओडी से हेयर लॉस हो सकता है. मुझे पीसीओडी और मैं बहुत टाइम से मेरा हेयर फॉल हो रहा है. क्या पीसीओडी वालों का हेयर फॉल रोक सकते हैं? और मैं भी पुणे से हूँ, आपके अपॉइंटमेंट के लिए क्या करूँ?
Yeah, so basically, yeah, polycystic ovarian syndrome can also associated with the hair loss. तो उसमें होता क्या है? So basically, there are hormonal irregulations are there. So ऐसे पेशेंट जब आते हैं हमारे ओपीडी में तो हम एडवाइस करते हैं उनको कि टेक अ हेल्प ऑफ योर गायनेकोलॉजिस्ट. सो गायनेकोलॉजिस्ट अगर जैसे हिसाब से उनके हॉर्मोन्स का इरेगुलरिटीज है वो हिसाब से उनको ट्रीट भी करेंगे. एंड साइमल्टेनियसली यू हैव टू टेक अ ट्रीटमेंट फ्रॉम योर डर्मेटोलॉजिस्ट फॉर द हेयर लॉस also. So that combination will work for you, and most of the times the gynecologist will advise about the yoga, meditation, lifestyle changes, and exercise regularly. Don't take any stress about your health, and that is not a permanent thing. How hormones can be regularized with the proper medications and treatment, and for that manage stress management most important thing. So you can take a help of your gynecologist also for that matter. So don't keep in mind that it is permanent thing. It can be a reversible thing. Yeah.
Okay, and for Dr. Google her name, and also she practices at Skin Logic and Medicare at Port Road. So you can always call and get the appointment of the doctor.
Yeah.
Okay, so
Yes.
I'll quickly take the last question because we are running out of time.
Yeah.
So the person is asking, hi doctor, my daughter is 12 years old and she has a lot of white hair. I have applied lot of turmeric oil and other remedies, but nothing is happening. Is there any way to stop this white hair, and why she's having these white hairs at such a young age?
Yeah, so graying of hair again, there is a pigment loss in your hair. So अभी जो ओपीडी में भी पेशेंट आते हैं तो अर्ली टू अर्ली 7 years के भी ऐसे बच्चे आते हैं जिनमें ग्रे हेयर की प्रॉब्लम बहुत ज़्यादा हो रही है. अगेन लाइफस्टाइल चेंजेस मोस्ट इम्पॉर्टेंट थिंग है. और ऑयलिंग जैसे मैंने बोला कि ऑयलिंग के बारे में मिसकंसेप्शन बहुत ज़्यादा है. तो ओवरनाइट ऑयलिंग करना उसको और ज़्यादा डैंड्रफ प्रोन करना और ज़्यादा उसमें स्काल्प पे उगाड़ना, वो उससे ज़्यादा है कि आप टेक हेल्प ऑफ डर्मेटोलॉजिस्ट, उसके मल्टीपल विटामिन जो होते हैं, माइक्रो न्यूट्रिएंट्स है, उनका लेवल एक बार चेक करके वो सप्लीमेंट शुड बी added in the treatment, so that she can take a definitely a help. For 3 months she had to take a treatment. Some topical serums and solutions are also there.
Okay, interesting. So, doctor, would you like to give any take-home message or any other suggestion to our viewers today?
Yeah, actually, don't self-medicate yourself. Go to a dermatologist, have a proper analysis of your skin and hair. Have a healthy practices of your hair care. Don't apply too much of chemicals. Don't go behind too much of chemical treatment like hair straightening, coloring, smoothing, and many chemical dyes that should not be applied. So, health of your hair, health of your scalp should be considered. If you are having any warning signs like red, inflammation, itching, and rashes, please go to a dermatologist, and wonderful treatments are available and take help of that. Thank you.
Thank you so much, doctor. Doctor, one of our viewer is asking one question, and he said, "Please, please ask." So I just asked this question. Like he's having this hair thinning on the top and falling hair with the black bulb. What can be the reason for his problem?
Okay, so there are some multiple instruments are there. There's one of most important, the trichoscope. With the help of trichoscope, we actually measure the density, volume, and the distance between the two hair. And the thinning should be properly visualized. After that, we ask patient what is the grade and what are the different causes behind the hair loss. And with the proper stress management and lifestyle changes, with the oral medications, with the test, and of course with the topical medications and procedure treatment, he can definitely take a help. So please have your consultation with the dermatologist and analysis of your hair, and don't afraid that this is not for the permanent thing, and that can be reversible with the proper guidance and treatment. Yeah.
Thank you so much, Doctor, for sharing all your expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful. And thank you so much, Doctor, for sparing your valuable time and giving us time. And we are so delightful to have you today. Thank you so much.
Thank you so much to all of the audience and
And also, thank you so much, viewers, for joining us today and asking so many questions. Yes, we could not take all the questions, but yes, next time, if our doctor have some more time, we can have our appointment and we can create more awareness on this platform for skin and hair. Until then, let's sign off for today. Doctor, have a very nice day.
yeah, have a nice day. Thank you.
Bye bye.
Bye bye.